Hi, I'm Rachel Taylor, the Global Director for Basics. Basics is very excited to be a 100 and Change finalist. The 100 and Change process has challenged us to think critically and creatively about how to catalyze and support transformative changes in healthcare hygiene. Our partnership, which includes Save the Children, the London School of Hygiene and Tropical Medicine, WaterAid, and Kinos, all of us have existing relationships and established presence in four countries with very high rates of healthcare-associated infections. And the goal of Basics is to support these countries to achieve dramatic reductions in those infections and thereby save lives. And we do that by facilitating hygiene behavior change in healthcare facilities, and we do it at scale. But how do we realize such a bold solution when it relies on individual and group behavior change in such a diversity of settings? I'll ask Robert to please start off by explaining how Basics will work with healthcare staff to change behavior and improve hygiene.
Over the past decade, researchers at the London School of Hygiene and Tropical Medicine have developed and refined the behavior-centered design approach, which Basics will deploy. Behavior-centered design combines evolutionary and environmental psychology with the latest marketing practices to create innovative and provocative behavior change interventions. This approach will be central to adapting Basics to unique local contexts. We'll begin with in-depth formative research, which consists of participatory methods inspired by anthropology, psychology, and other behavioral and social sciences. This will help us understand the individual, social, and cultural drivers of the infection prevention and control behaviors we want to change. The insights generated through the behavior-centered design process will help us tailor the basic solutions to each of our country contexts. These participatory methods will ensure that everything Basics does is informed by and responsive to local cultural context. This will maximize both individual and institutional acceptability and adoption of changes. This work is grounded in strong evidence in many countries. We're going to focus on two, Cambodia and Bangladesh, which are great case studies on behavior change. Diana, can you share your work on hygiene and behavior change in Cambodia?
Here in Cambodia, we also found that healthcare providers had limited knowledge about infection prevention control and hygiene. We also found that a lot of infrastructure and supply problems that we need to address. But addressing infrastructure and supply alone won't mean anything if we do not address knowledge, norm, and behavior around hygiene. For example, in Cambodia, many people believe that if their hands do not look so white, it means that they are clean. Also, open defecation is socially accepted, especially when there's abundant open space. There is very limited research on hygiene, infection prevention, control practice among healthcare workers in Cambodia. We know how they behave, but we need to dig deep to understand the underlying reason for why they behave that way. This is why starting with formative research is critical. Our previous work make us confident about the impact of behavior change intervention in Cambodia. Over the past 6 years, Save the Children has gained solid experience in health-based behavior change. We just finished our 6-year knowledge program, which targeted behavior in health, water, and agriculture. The impact of changed behavior is very significant, including a 75% drop in open defecation in our program area. Jana, you also implement a project in Cambodia as well.
WaterAid and the London School of Hygiene and Tropical Medicine, the National Institute of Public Health, and 17 Trigger have used the behavior central design to develop a novel intervention to improve hand hygiene practice among midwives. We identify the personal, institutional, and cultural driver of hand hygiene practice, and are now testing a model that combines with national infection prevention control training, emotional messaging that reinforce midwives' desire to provide quality care, and environmental cue to trigger the hand hygiene at key moments. We are working with midwives to make small change at their work area and empowering them to hold themselves and facility accountable for good hygiene practice. The model being tested in primary healthcare facility and hospital, and will measure midwife compliance with good hand hygiene practice during childbirth in late 2020. Yeah, this learning will be very useful when we start implementing BASIC.
We are very excited about the impact of our programs addressing healthcare-associated infection here in Bangladesh. When we started, there were quality standards for infection prevention in place, but they were simply not complied with. Staff were not adequately trained, supplies were limited at best, and there were no systems in place to ensure that the healthcare facilities practiced effective hygiene. Only some staff understood the importance of hand washing and using the disinfectants. We had to also address the use of widespread traditional but harmful practices like applying cow dung or corrosive mustard oil or ashes to the newborn's umbilical cord. We were successful in helping the staff to transition to the use of chlorhexidine through guidelines, trainings, and development of effective supply chains. It was a long process, but it worked. We collaborated with the Ministry of Health and Family Welfare to develop the guidelines such as the National Maternal Health Standard Operating Procedures and the institutionalization of quality improvement approaches. We engaged with the full range of healthcare professionals, the doctors, the nurses, the paramedics, the community health workers, and the others. We trained, we mentored, we launched a mass campaign for hand washing, and people responded.
I should add that in the example Dr. Afsana has shared from Bangladesh, 85,000 healthcare staff in 64 districts were trained in the use of chlorhexidine application to prevent newborns dying from serious bacterial infections. An independent evaluation found that 86% of those healthcare staff were still proficient in the application of chlorhexidine, even well after their training. Evaluators also found significant improvements in the proper sanitizing of medical equipment, including the bags and masks used to resuscitate newborns who were not breathing at birth. Saving lives by changing behavior and reducing hospital-acquired infections is possible. We've seen this in Cambodia, in Bangladesh, and many other countries. And as you've heard from my colleagues, BASICS is ready to draw upon those experiences, upon the global evidence, and on local capacity, together to initiate and sustain behavior change both at individual and institutional levels. We are really excited to advance this bold solution in health facilities and across health systems. To ensure we implement with rigor, hold ourselves accountable, and capture what we learn along the way, we'll develop a very robust monitoring, evaluation, and learning plan. Drawing upon data from healthcare facilities, we'll measure changes in staff and patient behavior, changes in infection prevention and control, and also in health outcomes. We'll also study the costs and cost savings associated with the BASICS model. Over time, as we improve hygiene practices and reduce infection rates, we believe that health facilities and health systems will save provider time, increase bed capacity, and they'll save funding. Together, these valuable resources can then be made available for other critical purposes. These data and results will support ministries of health to scale the approach nationally. And based on what we learn in the first 4 countries, we'll develop guidance and toolkits to support adaptation and implementation of BASICS in other communities and countries. As the current COVID-19 pandemic has shown us all, the risks of poor infection prevention and control are not theoretical. They're real, and changes in practices and behaviors are essential to stop the spread of disease. We would like you to join the conversation on the critical role that infection prevention and control and behavior change plays in quality healthcare and positive health outcomes. Please visit our website and join our social media platforms listed at the bottom of the screen. And to learn more about the MacArthur 100 and Change program, which is what inspired the formation of the BASICS team, please visit our website. Thank you very much for your interest in BASICS.